Dear colleagues and partners, leaders, community members, TB survivors, Namaskar and welcome to the India TB Summit 2022. It is my pleasure to welcome you to join us for the second edition of the India TB Summit, hosted in partnership with the Indian Express. The world has changed in more ways than we can imagine. The pandemic has made us realize our immense vulnerability, but also our collective strength. We can only defeat the challenges that confront us today if we come together. The challenges in TB, but more broadly in health, are now staring us more clearly than ever before. Inequity, inequality, and lack of access. This summit is a response to the challenges that we have witnessed over the last 2 years in fighting TB amidst the ongoing COVID-19 pandemic. The pandemic and its impact on TB and also other diseases has made us realize that the focus on cure is insufficient. We also need to think about prevention, access, equity, and affordability, whether it be TB or COVID-19. We are at a turning point in history. We have to see and examine if our approaches and tools, not just for TB or COVID-19, but all healthcare, are they sufficient or not? Are the current approaches people-centered, and do they put the individual and the community at the center of their efforts? The truth is that comparing TB to COVID itself is like a study in inequity and injustice. A centuries-old disease which has just one vaccine, and a relatively new and recent disease where we are almost spoilt for choice. A centuries-old disease that is curable, but those affected are still asking for access to new diagnostics and new drugs. Those affected who cannot still access treatment because it is either too expensive or they feel too stigmatized by their communities, by their families, and the health system. Really, the question that this summit poses before us is, have we done enough for the TB affected? In TB, the time has come for all of us to come together and collectively rethink and redesign TB care, not just in India, but also elsewhere, to ensure justice and equality. Hence, the theme of the summit this year is redesigning TB care for equity and access. As always, the summit brings together leading national and global experts, survivors, advocates, to form and lead the discussions and the sub-themes of this event. You will hear from all of them, but most importantly, you must remember the stories of millions who are forced in silence and suffering due to TB-related stigma. The summit represents their voices, their needs, and their demands. Every aspect of this summit has been developed with inputs from survivors and communities. In a 2-day rigorous program, the summit will bring together communities, experts, clinicians, public health workers, policymakers, researchers, and advocates. Through these efforts, we hope to engage in inclusive discussions and combine diverse perspectives and create awareness through an independent public discourse around TB. Most importantly, we seek to put those affected by TB at the center of all our strategies and efforts. Every panel has been independently curated by the chairs to ensure academic rigor and independence. And every panel has a community representative because without their inputs, no solutions are possible. We are extremely grateful to our academic committee as also our chairs who have, despite their exacting schedules and timelines, curated a robust and thought-provoking program ensuring diverse participation and perspectives. We're also grateful to our supporters who continue to understand and effortlessly support the value of an inclusive national forum such as the India TB Summit. But most importantly, we are grateful to the TB-affected individuals and communities who have, over the last several decades, shared with us their lived experiences, their stories and experiences that inform all our strategies and efforts. We salute your courage, your commitment, and your hope. I want to end by saying that this is more than just a forum. This is an opportunity to bring together issues, approaches, and innovations, but also people in an inclusive way to generate transformational change and ideas and thought-provoking discussions. Every person's input is important because all of us need to work together to end TB in India. With these words, we agree to argue, to disagree, and to challenge each other, because without debate, no change is possible. I thank you again for joining us for this summit and look forward to your participation in it. Namaskar.